system. The two main jobs of the lymphatic system are to maintain fluid balance and immunity, which is to defend the body against infections, viruses, bacteria, and disease, as well as clear toxins, waste, and excess fluid. Just outside each capillary are tiny spaces between the cells. These spaces are filled with interstitial fluid. It is through this fluid that the oxygen and carbon dioxide exchange and nutrients and wastes travel. This fluid is really part of the blood and mostly gets reabsorbed by the capillaries. However, some proteins are so large that they can't go back into the capillaries, and these proteins, along with some interstitial fluid, are sucked into the initial lymphatics and then into the lymphatic capillaries. At the moment of this transition, the interstitial fluid is officially called lymph. Lymph is a milky body fluid that contains proteins, fats, and a type of white blood cells called lymphocytes, which develop in the bone marrow. Lymphocytes are part of our defense against bacteria and viruses. Lymphocytes make up about 25% of all the white blood cells and include B and T cells. From the lymphatic capillaries, the lymph flows into lymph vessels. At some point along the line, lymph enters a lymph node. Lymph nodes are cleaning stations that break down harmful substances. There are small lymph nodes all over your body. However, some of the main lymph node groupings are the submandibular nodes, a chain of cervical nodes cleaning the lymph from the head, the axillary nodes, cleaning the lymph from the arm and upper torso, and the inguinal nodes, cleaning the lymph from the legs. After the lymph has entered the inguinal nodes, it goes deep into the body and travels up the thoracic duct, which picks up the lymph from all the organs, eventually dumping the lymph back into a vessel near the heart. Although there is no particular pumping organ connected with the lymphatic vessels to force the lymph onward as the blood is forced by the heart, it still moves slowly and steadily despite the fact that mostly it's happening uphill or against the pull of gravity. So nature, in all her wonder, provided hundreds of tiny muscular units called lymphangions to contract throughout the body and propel the lymph through the large number of valves to permit flow in only one direction. Lymphangions work in conjunction with the autonomic nervous system, and because of this, their action can actually be hampered by fatigue, stress, emotional shock, colds, infections, or lack of physical activity. Conversely, exercise, emotional stability, proper nutrition, and care of the body create positive lymph flow, thus enhancing the immune system. Swollen glands are the most recognizable symptom of an overactive lymph node. If a client has swollen glands, it may mean that they are fighting off an infection or virus. Lymphatic massage proximal to the location of the swollen gland may be helpful. A common condition that includes swollen glands is a cold. Medically, a cold is described as an upper respiratory tract infection. It usually includes a sore throat, cough, and a runny nose. Gentle massage can be helpful in the beginning and end of a cold when the person has some energy to process the extra toxins kicked up by the massage. In the middle of a cold, however, when the person is very tired, massage should be avoided because it will just make the client more tired. Fever is an abnormal condition of the body marked by an undue rise in body temperature, a quickened pulse, and a disturbance of other bodily functions. Fevers are usually brought about by immune system reactions due to invasion of pathogens such as virus or bacteria. Fevers can also indicate that a person may be fighting an infection. In cases of fever, massage is contraindicated because the body is trying to isolate and destroy the virus or bacteria, and massage will just spread it around more and even make your client weaker. Edema is a swelling caused by the buildup of interstitial fluid in the body tissue. Peripheral edema is the most common and usually occurs in the feet and the legs. The less serious causes of edema can be birth control pills, premenstrual syndrome, protein deficiency, sodium or potassium imbalance, and minor injury. Normal Swedish massage has the effect of causing vasodilation, which increases the blood flow and the fluid in the interstitial spaces. In the cases of edema, this is exactly what you don't want, so normal massage is contraindicated in all cases of edema. Lymphatic massage, however, because it's light pressure, is wonderful to perform in cases of edema. Before going ahead with lymphatic massage, it's important to know what the cause of the edema is. If it's a sluggish lymph system, then massage is appropriate. If the cause is a chemical imbalance such as liver disease, kidney problems, malnutrition, lymphatic massage may not be helpful. Lymphangitis is inflammation in the lymph vessels. The symptoms include thin, red streaks extending from a wound, bite, or infected region. The agent that caused lymphangitis may eventually spread into the bloodstream, causing blood poisoning, which is a serious condition, maybe life-threatening. Massage is contraindicated for all types of lymphangitis, with no exceptions until all signs of the infection cease. Chronic fatigue syndrome is a viral disease characterized by a series of flu-like symptoms such as sore throat, swollen lymph glands, low-grade fever, headaches, and muscle pain or weakness. The origin of this condition has baffled the medical community for years, but some theories suggest that the cause may be due to anemia, low blood sugar, long-term stress, or environmental allergy. The primary treatment for chronic fatigue syndrome is making lifestyle changes, particularly in reducing stress and being kind to your body. Regular massage is highly recommended and is a wonderful tool to help support these emotional and physical shifts, except when accompanied by fever. Hodgkin's disease is a type of lymphoma, which is a slow-growing tumor arising from the lymph nodes. It's a highly treatable form of cancer, particularly in cases of early detection. Painless swelling of the lymph node is the principal symptom, along with fatigue, low-grade fever, night sweats, itchiness, and weight loss. There are many schools of thought on whether or not massage is helpful or hurtful. Vigorous or deep massage is generally contraindicated, but gentle Swedish and lymphatic drainage massage may even be recommended by their doctor. Each case should be considered carefully. For the person who has been free of cancer for several years, massage is perfectly appropriate. HIV, or human immune virus, is a disease that causes AIDS, acquired immune deficiency syndrome, by infecting helper T cells of the immune system. AIDS is manifested by increased susceptibility to opportunistic infections such as pneumonia, cancer, and neurological disorders. It is transmitted chiefly by exposure to contaminated body fluids or hypodermic needles. Massage is recommended for all stages of HIV infection, but only if the therapist is healthy and does not put the client at any risk. Massage can greatly relieve chronic muscle tension and ease the mental and emotional stress that accompanies the illness. Massage techniques. To focus on the lymph system, use a light touch massage that stretches the skin and moves towards the nearest node grouping. Lymph work is done starting closest to the node and then working back. This technique is pushing the lymph towards the axillary node. Lymphatic massage is too light to increase circulation, but is excellent at stimulating the lymphangions, which will increase lymph flow, draining the fluid from the interstitial spaces. The fluid between the cells is called interstitial fluid, lymphatic fluid, blood, marrow. The correct answer is A, interstitial fluid. The tiny muscular units of the lymph vessels are called myolymphatics, lymphangions, vasodilators, vasoconstrictors. The correct answer is B, lymphangions. This condition is characterized by swelling